It is 5:13. Some new, more relaxed COVID-19 guidelines have recently been issued by the Centers for Disease Control and Prevention. For the first time since 2021, it's updating its COVID-19 isolation recommendations.
But just what are those new guidelines and how will they impact those with compromised immune systems? Our Cheryl Coonan learned more and joins us live from the Great Lakes Bay Region newsroom.
Good morning, you guys. Yes, well, those restrictions now saying that people infected with COVID-19 no longer need to stay away from others for at least 5 days, but rather until they've been fever-free without medication for at least 24 hours. This brings the guidelines in line with the CDC's advice for other respiratory infections like influenza and RSV. The change ends a strategy from earlier in the pandemic that experts say has been key to controlling the spread of the infection. Bay County Public Health Officer Joel Strauss says when the pandemic began, virtually no one had immunity to it, but now, through both the spread of COVID and vaccinations, he says the immunity has grown substantially, leading to the more practical guidelines.
We are long past the pandemic stage. That ended probably at the end of 2022. And now we're firmly in the endemic stage, which means that COVID is just a part of life. It didn't go away. It's a part of life. And generally isolating when you're not feeling well enough to maintain normal activities, just like a regular cold or flu. It's like if you're sick, stay home.
Health experts still recommend taking precautions for 5 days following the absence of a fever, like improving ventilation and masking up, particularly around vulnerable people or those with compromised immune systems. Coming up, we'll talk about how the new, more relaxed guidelines may impact summer gatherings and travel. Live from the Great Lakes Bay Region newsroom, Cheryl Coonan, ABC 12 News.